Hi everybody, this is Amy Paulson. I work with Katherine Barmer on the Emerging Technologies in Public Health campaign. This campaign developed a social network community for emerging technologies in public health. A little bit of background on emerging technologies in public health. The reason why we created this is that there was no formal social network out there that we could find for emerging technologies specific to public health. We began this on February the 14th, not intending for this to be a big project, but just to develop a Facebook page for our Public Health 690 class to be able to communicate, share links, share information, and it quickly gained outside followers when we contacted a few of the other schools of public health. We like to say that this project we didn't choose it, it really chose us. As we continued to work on it, it gained followers, gained interest, and we became more and more engaged in trying to figure out how do we get it to work so that we increase our reach and get responses. And so we ended up also creating a Twitter account that's associated with it to help increase that reach. And the other reason that we did this is because it really filled a need among the public health community to be able to share resources on emerging technologies and to create a community around it. So this is our story. We have a Facebook and a Twitter presence for emerging technologies in public health. Seems to be pretty well followed at this point, and we'll talk a little bit about what we've done and what our goals were and what some of our outcomes were. So our initial goal was just to create an information sharing network related to this topic, both focused on social media but also on other technologies as they apply to public health. There are some other communities out there that were focusing on health and healthcare services, but none that were specific to public health. So some of our goals were to get 100 fans and 100 followers by April. As of today, we have well over 100 fans for Facebook community, about 102 as of the 27th of March. And on the Twitter account, we had 147 on March the 27th. We have a well into the 150s at this point here on April the 1st. And so it's very exciting for us to see people getting interested in what we're doing. And some of the other outcomes that we had both on Facebook and Twitter. This was as of March 22nd. On Facebook, over the course of about the month and a half that we ran this, we got 58 likes and comments to what we were posting. We had 397 monthly active users, 188 weekly active users, 63 daily active users, and over 20,000 post views. 70% of the population that likes our page on Facebook is female. On Twitter, originally when we did this presentation, worked it up the other day, we were listed in 5 lists. Lists are where other people put your Twitter account handle in as something that's associated with something that they want to share. So they have a list of favorite public health sites or something like that. So we're in several of those lists. We're actually in 6 lists now. We also had multiple retweets of the information that we were posting and responses to the information, especially when we participated in chats that were being held by another associated group. Some of the strategies that we wanted to use were to contact public health partners to market this project. So we did a lot of cross-posting of trying to recognize other public health groups, both on our page and Facebook, and in reposting and retweeting information on Twitter to try to get attention from other public health groups. Directly contacting and liking the Twitter accounts for some of the major schools of public health and posting to them information on what we were doing. And so we were trying to cross-utilize social media to reach new stakeholders. We wanted to be able to post in relevant tools for the emerging technologies in public health at least 2 times daily. Trying to do the reciprocal likes between us and other groups, and to utilize engagement techniques like asking questions of our users, posting hot topics to try to encourage response. And at least 2 times a week we tried to use Twitter to direct our followers from Twitter to become fans on Facebook and our Facebook fans to become followers on Twitter. So we try to cross-populate the population so that we could get the most reach. So in terms of competitive intelligence, what other groups are using Facebook and Twitter for this same type of work, well, we really didn't find any groups that were doing exactly the same thing that we were. Most of the ones that were out there were focused on healthcare services, individual healthcare services rather than public health. So there were none really competing, and we found that like communities were in general very friendly and welcoming, and we often posted challenges to them to broaden the perspective from individual healthcare to a broader public health viewpoint, which got a lot of great responses from some of the other users, and had quite a few people tell us that they would participate in a chat if we had one focused on public health and emerging technologies in public health. Some similar groups to us on Twitter were the Healthcare Social Media Group and the Health is Social group. So what are they doing well? They're really doing a fantastic job with utilizing Twitter chats to coalesce their communities, to create dialogues, and to get people excited about continuing to converse using social media for healthcare. And what they didn't do so well is they didn't really seem to have a very good Facebook presence. They had no public health focus pretty much. It was mostly clinically oriented, and so we were able to help change some of those viewpoints by throwing different perspectives out during chats, but their questions and focus were generally speaking on individual healthcare services and social media rather than a broader public health and a broader emerging technologies focus. And they didn't seem to have any sort of national group backing like CDC or any other of those groups that we thought long term we would like to see emerging technologies and public health affiliate with. So in terms of the growth of our emerging technologies and public health social media communities, we started out with Facebook. We added Twitter. About a week in, we started tracking the number of followers that we had. Started out with only 37 on Twitter and 56 on Facebook when we started tracking it on the 21st of February. And very quickly noticed that the Twitter community became much more active much more quickly. And around early to mid-March, we started participating in the chats. And that really boosted our community incredibly. Facebook kind of kept puttering along there, slowly gaining followers, but where we've really seen the most boost are on Twitter, and mostly from participating in chats and also from retweeting other people's tweets and recognizing them, responding to them, seemed to gain followers, especially if we did one, if we responded or retweeted to a post on somebody that was followed by a lot of people. So some interesting things there. Definitely Twitter is the place to be for this particular community. Some things that we'd like to borrow long term that we didn't use this time was to be posting video clips. We really didn't do that. We think it would be a great opportunity. We did post interesting articles, and those are ideas that we borrowed from other groups that seem to work well, providing links to those types of information. Some ways that they engage users were to, again, cross-post Twitter to Facebook, Facebook to Twitter, and other types of social media. Liking other health professional organizations was very effective because a lot of times if we liked them, they'd like us back, and then we would cross-post with them as well. Asking questions of our users was something that we borrowed from other groups that seemed to work well for us, as well as participating in the Twitter chat, something that other groups were doing to engage their users that we would like to steal at some point if we can get some other people interested in helping to keep this going. So in terms of the practice of what we did, we founded this in February. Some early successes were that we created an outlet for really an organization that did not previously exist. Found that liking other public health organizations and having them reciprocally like us back was very effective. Gaining followers with the Twitter chat with Healthcare Social Media Group was very effective. Cross-posting Facebook to Twitter, Twitter to Facebook was effective. And another thing that we found very effective is there's a website called wefollow.com that when we posted to that, we quickly got another bunch of followers on Twitter. So it seems like something good to continue to do. Our main challenges were engaging participation and response from our followers and likers. We were never quite sure, particularly on Facebook, if it was that they just weren't looking at our stuff. We had over 20 post views, so we think that they were seeing it. We know it was coming up on their page, but whether they're actually reading it and thinking about it, or whether maybe they just didn't respond, we're not sure. We did have some response, but not the kind of response that we would like. We had more response on Twitter, more active engagement on Twitter, although still would have liked more, and I think there's a lot more to be learned about how to do that and do that well. Some recommendations that we would make to moving forward from here, if somebody would like to engage with this particular project, is to continue to grow our community. Bunches of different ways we can do that. First of all, engage with the CDC social media campaign. They've got a website. They've got an email listserv. They do not have a social media presence yet, and that might be a great opportunity to work with them Consider adding a Twitter chat either weekly or monthly for emerging technologies and public health. Maybe it's something that we could do in collaboration with healthcare social media since they do have an established following, but it's a good opportunity. Develop a blog where we could have guest posts and other types of information so that we're driving our followers and fans directly to very specifically applicable information. Would be nice to have a YouTube channel or even do podcasts. That's something that some of the other groups do. Seems to be very popular and a great way to gain support and interest and get the word out. We would also recommend that we use Twitter as the primary social media outlet for this type of initiative, as that seems to be where the activity and the momentum is right now. But continue to use various other methods of social media in conjunction with that so that we don't accidentally eliminate potential community members since we do like to cross-populate, and that seems to be working well for us. We'd also recommend that a sustainability plan be developed. We're really hoping that some of our fellow students would be interested enough in what we've done to jump on board and maybe take control of the reins for a week or a month at a time. It could be a great practicum project for somebody, and we're also hoping that the next Emerging Technologies and Public Health class will be interested in continuing to work on this. Definitely Katherine and I want to stay somehow connected to it. We'll post occasionally, but we might go into a little bit more of a sleepy mode for a while as we finish out the semester. And we'd also like to make a recommendation that a formal evaluation of what we've done here and what worked and what didn't work be made. I think there's some lessons to be learned, as there's not a lot of great research out there yet on what works and what doesn't work, particularly related to public health professionals and the use of social media. So that's what we did. This is our recommendation, and we had a great time working with emerging technologies and public health, both on Facebook and Twitter, and we look forward to seeing how this community continues to grow. Thanks so much. Have a good semester. Bye-bye.